The World Health Organization has been at the forefront of the world's battle against COVID-19, working round the clock in many countries, including Nepal. As of this moment, COVID-19 has claimed the lives of over 600,000, and in Nepal particularly, more than 50 people have died due to coronavirus. While many countries have managed to contain the virus spread, the number of infections in Nepal has been rising in recent time, and there are chances that the numbers might be even higher now that the nationwide lockdown has been lifted. To talk more on Nepal's COVID-19 management, today we have with us WHO's country representative, Dr. Jos Vandelaer, who is a medical doctor and also public health expert whose career spans over 3 decades. Dr. Vandelaer, welcome to Kantipur News.
Thank you very much.
Now, how would you see or define the phase that Nepal is right now when it comes to coronavirus crisis?
Right now, Nepal is in an in-between situation, I think. We've seen many cases in the last couple of months that were by and large all from people who returned from abroad, particularly from India. And we have seen very few people who were infected in the communities. So right now the number of cases is going down because the number of people coming back to Nepal is going down. But it is to be expected that very soon the number of cases will start going up, and very likely those cases will be in the communities.
Are we prepared, or do we have adequate resources to handle a situation that for now seems like ominous?
Is any country prepared for a situation like that? That's the big question. And so, as we have seen in other countries also, a pandemic like this quickly overwhelms the health system. But in Nepal, I think we have been lucky. We have been lucky that the lockdown, which was called very early on after the second case, actually has kept things in check. And then when people started crossing the border, these people were quarantined. And so also that has helped to prevent that the virus further spreads. Now in that period, quite some work has happened. A lot of work has happened in terms of getting supplies in the country, in terms of trainings, in terms of getting the hospitals ready, on communication, on surveillance, on getting better data and so on.
How has WHO been engaging or interacting with the government of Nepal to manage this crisis?
Yeah, we're working very closely with the government of Nepal, particularly the Ministry of Health and Population. What we have done early on is, for our whole office, basically all the staff have been working on COVID. Several of them are posted in the government premises, are working together with their colleagues directly. We also have teams up in the provinces to help the provincial health authorities to work on this epidemic.
The Health Ministry some time back issued guidelines on COVID-19, which it said included recommendations made by the WHO. There were some counterproductive guidelines, for instance, keeping a person in quarantine for 2 weeks and then letting them go.
First of all, WHO advises the government. We don't make the decisions. The government makes the decisions. So what we bring to the table is basically what is the current knowledge, what is known globally about this disease, and also some comparisons, what are other countries doing. So some experiences. That's what we bring to the table. The final decision is actually the government's. Now, in quite a number of discussions we participate as one of the partners, not just us, but also other experts are being brought in to advise the government, and so that they can make an informed decision. To your specific point around quarantining, indeed, if you quarantine somebody for 2 weeks, the person can go home without a test. There's actually nothing wrong with that, provided the quarantine is done well and the person has not had a chance to infect other people or get infected by other people while in quarantine. I know there has been some controversy around this, but again, strictly scientifically speaking, if the quarantine is done well, you don't really need a test after 14 days if you keep the person in quarantine for 14 days, because after 14 days the virus is no longer livable if the patient was even infected.
The government has yet to confirm community spread of coronavirus so far. What do you think of it?
At the moment, there is no widespread community transmission. We have seen a number of cases where there is not clear evidence of travel. And so these patients or these people have gotten the virus from where they live. So at that point, there has been some transmission in the community. But where that has happened, it has always been very localized or small clusters. That means small groups of people without spreading into its other communities. So there has been some localized community transmission, and it's still going on. But we have not seen so far widespread community transmission.
The WHO has said that a vaccine this year might be unlikely. What does that mean for a country like ours?
Developing a vaccine is usually many, many years. For COVID, things are being accelerated, and the way they accelerate is different ways. One is there are many different groups looking for a vaccine, and they're all working on this. So different vaccines are being developed, over 120 different vaccines worldwide, and we don't know which of these vaccines will be successful. And it's only like a small percentage of vaccines that are initially developed that actually in the end also work well. So this is one way of doing it. Many people are working on it. The other way to do it is also happening, is that the different phases of vaccine development are being kind of done at the same time. So that, for example, some producers are already building the factories to produce the vaccine, although the vaccine doesn't exist yet. That is on the assumption that they will find a vaccine. And of course, there's a huge risk there, but in order to speed things up, you can't wait. You can't wait till you have a vaccine and then start building. So these things are done in parallel, so that once there is a vaccine that works, it can be very quickly made, very quickly be produced and distributed. The exact timing is very hard to predict, but I think everybody hopes that by next year there will be a vaccine that works and that will be made available. And so to come back to your question, what can Nepal expect? Well, we certainly hope that when there is a vaccine available sometime next year, that a certain number of doses will be made available for Nepal for very, very vulnerable populations in particular, and also at a cost that Nepal can afford, so a subsidized cost. And again, as I said, the work is happening at global level on that.
So at this juncture, what do you think is the right path for the government of Nepal and also the people of Nepal to avoid a fate that of countries like Spain, Italy, or the US?
Yeah, what we see in a number of countries, particularly in Europe now, is basically a second peak starting. What has probably happened in these countries is that once the first peak was over, people went back to life as normal. And what does that mean? Not enough distance, no masks, basically giving the virus a chance to circulate. That's basically what has happened in these countries. What can Nepal do? Well, avoid that. We have had a lockdown. And that was very hard. That was very hard on everybody. Many people lost their jobs, didn't have an income, businesses couldn't do their thing. So I think it is absolutely normal that after a while, a government not only looks at the health side of things, which is what the lockdown is for, but also at the social and the economic impact of a lockdown. And therefore, after a while, governments, even in the uncertainty of the pandemic, loosen up the lockdowns or kind of get completely rid of it. But that doesn't mean that the epidemic is over. Because even without a lockdown, all of us must play our role of keeping a distance, wearing a mask, particularly in public, washing our hands, not coughing onto other people, and so on. So that's something all of us can do, and we must do that. At the same time, I think also for the government it's important to keep an eye on what's going on. Because if there is a sudden increase in cases, the government may very well decide to restart the lockdown. And that can be a full lockdown, a partial lockdown, that can be in certain geographic areas. It doesn't have to be a nationwide lockdown. But if there is a feeling that people actually don't adhere to the basic rules, the government may again have to step in and say, well, sorry, but for a number of weeks, you cannot do what you normally would do. You have to stay home again, or you cannot not go out, or you cannot meet your friends, or whatever it is. And therefore have a kind of a full or a partial lockdown, or a geographically focused lockdown is certainly one of the options that can happen.
Dr. Vandelaer, thank you so much for your time.
Thank you very much. It was my pleasure.